board.
I think it automatically does that. Yeah, it's automatically recording. Okay. Brenda, I think you're live, just so you know.
Yes, yeah. I was watching numbers to make sure that everybody who's waiting in the queue to get in could join us, but I think we'll just
great.
launch.
Okay.
Welcome, everyone. Thanks for coming in out of this gorgeous day, or maybe you're out on the playground or on your back porch. But welcome to our May conversation with Sally Kerschner and Margaret Tarmys and Dr. Breena Holmes from the Vermont Department of Health. They are with us again today to talk about COVID-19, childcare and out of school time in spring and summer of 2021. And after sharing Vermont's most up-to-date information and guidance, they will answer your early childhood related questions. And as always, you will be able to revisit these slides and the answers to your questions on the Let's Grow Kids website. That's letsgrowkids.org. Remember to use the Q&A box for any live questions that you have today. So again, welcome, and I'm going to turn it over to Dr. Holmes and Margaret and Sally.
Great. I can offer a few words. This is Sally Kerschner. As a bit of an introduction, you folks know Sally, me, and Margaret Tarmys. We're nurses here at the Health Department, the Maternal Child Health Division. And Breena Holmes is our medical advisor, and you folks know Breena really well. So we're doing these monthly calls. Margaret and I will do some basic information, and then because things change so quickly, for good reasons, we're having many decreased cases. So our guidance is changing all the time. Not the official CDD guidance, which is updated, but a lot of other guidance from the governor is changing, so it gets confusing. So Breena was gracious and able to be on to give us the inside scoop in addition to some of the information Margaret and I have for you. And I'm not seeing, are the slides up and I'm just not seeing them? Or
Is any, oh, sorry, you're not seeing them? Hold on one second.
are other people seeing them? I could be the outlier. Oops.
How is it now?
Oh yeah, there's some slides.
Okay,
Thank
my
you.
apologies.
That's all right.
I did move from this slide to the next one, if that's okay.
Yeah, no, that's okay. And as you folks probably know, I'm assuming that the governor has the grand plan for moving us out of this pandemic. It's called Vermont Forward. We've been going through step 1, step 2, and into step 3. One of the main criteria is for knowing when to move forward or when to not move forward is numbers of Vermonters vaccinated. As of today, there's number of Vermont residents with at least one dose of vaccine is 65.5%, and Vermont residents who have completed their vaccinations, it's 48%. So that's moved us into step 3, which is heartening and encouraging. However, there's the different guidance for like the schools, childcares, summer programs, which at times can be confusing. So that's one reason why we have these webinars. The other thing I wanted to make sure.
Hey, Sally.
Yeah.
Hey, I was just hoping Kathy could put the slides in the bigger mode. We don't need to see the next slide and all the notes. This is the presenter. There's
That's a
no
good
formatting. Point. Yeah, it's hard, but much easier to read. I even have my glasses on and it's hard to see. Yeah. Thank you.
Yeah, I thought I was sharing a different screen, so thank you.
There's too many options with this.
How's that one?
There we go.
We go.
Sorry about that.
Thank you.
That's right. One thing I wanted to say, and I think, Breena, you may be getting into this too, that to make sure people know there's a series of evening webinars presented for families about vaccine. The list is on our website, Health Department website. I assume it's on the AAP, Vermont AAP website. It's a local pediatrician, and Breena, I think you've been on some of them. These are like hour-long chats, webinars for families who have questions about vaccine. So just to make sure you folks know they are happening, I've sat in on a couple, they're really helpful. And the list of, I think they're scheduled through the end of this week, and then they're kind of not just last week and this week with the rollout of the vaccine for the 12 to 15-year-olds, to make sure that parents have a lot of opportunity to ask questions and understand about the vaccine. So that's going on too. I just wanted to say that because I don't think that's in our slides. Okay, next slide. And then this is our ultimate goal of July 4th, and with the sectors having like universal guidance is the term we've used, of masking, distancing, in general good practice throughout places, whether you're going to a restaurant or going shopping. And again, there's further detail or guidance for folks like you who run the specific childcare programs. At times it needs to be more detailed for what you folks do in the front line with the young kids. And that continues to be detailed in the guidance from Child Development Division. So next slide.
Hi, folks out there. This is Margaret. So yeah, we wanted to just kind of review a bit of the specific sector guidance that is still in effect with step 3 of Vermont Forward's plan, and was recently with many revisions that went into effect May 1st. And Breena did a really amazing overview of that on April 29th. But we just wanted to do a super quick high level of some of the changes, because it's still pretty new, and we're all still just kind of adjusting to, kind of riding the downhill curve, or the downhill slide or wave of COVID. So just wanted to highlight a few changes. When you do get these slides, the red revised sections effective May 1st is the hyperlink to the guidance if you're trying to find it online. So just really kind of briefly, a rundown is for health screenings, these are no longer required of the childcare provider to actually do, of staff and children. We have really shifted into personal responsibility. So families and staff themselves should be doing health screenings at home for any COVID symptoms, and if they were a close contact of anyone with COVID, and then if they are, not come to care or come to work. As far as the next bullet, returning to work, if you've been sick, we want you well, and all of the kind of regular procedures around only come to the setting if you're healthy. And then if you've also been vaccinated and you're having side effects, you're having chills, or maybe you're febrile, or you just have a bad headache, or you're exhausted, you should not be working, not be coming to this setting. As far as drop off and pickup, this has shifted quite a bit. We're really kind of back to more traditional drop off and pickup. We certainly just encourage you to structure this in a way that suits health and safety of children and families. But it doesn't have to be staggered anymore in the way in which it was. The health screenings kind of were occurring at that staggered drop off. And again, that's really to occur in the home setting presently. So, this is certainly an opportunity when people are doing drop off to make sure you get information from families about how folks are doing. Just want to reiterate that, the traditional sort of caring for your children guidance as childcare providers, you absolutely, as part of providing high quality care, are needing to know how your families are doing, how the children are doing. So certainly continue to do your routine visible assessment of, this little kiddo that I know so well is, acting a little different. And, if you think you should take a temp, go for it. So just encourage you to do those things. As far as transportation, really the primary things are airflow. So if you happen to be transporting people, we definitely want ventilation and airflow. The guidance has always been do the best you can, keep kids as spaced out as possible in a vehicle. No one who's sick should be riding along with anyone. And we do have masks being a part of the protective layer and should follow the Vermont Forward Plan. As far as hand hygiene, just really quick, this is so important. You all might be familiar with your Caring for Your Children guidance. This is basic infection control practice, and there's a whole lot of hand washing going on before and after preparing food, eating, handling food, giving medication, playing in water, and then aftering a whole host of activities, diapering, toileting, bodily fluids, sand, animals, a whole gamut. So keep up the hand washing. And as far as cleaning, we are back to our standards of cleaning and disinfection. There's a really nice Appendix K in the Caring for Your Children, which is a nice grid for outlining when things need to be cleaned or sanitized or disinfected. I definitely encourage y'all to get a look at that if you haven't seen it recently. And again, sort of the reasoning with the routine cleaning and disinfection is because we've learned so much that the primary mode of transmission with COVID is through respiratory droplets. So just routine cleaning of surfaces with soap or detergent is sufficient to reduce risk in most situations. Lastly, on this slide, as far as just kind of a quick rundown of where we are with volunteers and visitors. Volunteers who are kind of helping with your programming are allowed if they're vaccinated. And as far as visitors go, we're talking parents here. We are in step 3, are discouraged at this time. And just to kind of clarify further, if you've got visitors that are coming in, and are supporting your education or providing support services, they are allowed. So next slide, and I'm going to hand it on over to Breena to talk about masks.
Hi, everyone. So this is the crux of the whole, of all sorts of important communication. But unfortunately, where we sit today is we don't have a final policy decision from the leadership on what to tell you. So we are sticking with everyone's mask in the childcare settings. Adults, children are still strongly recommended, as it's been all along. And that doesn't change regardless of your vaccine status today. So many of you have reached out and asked us, why can't a vaccinated childcare provider take her mask off? It's a great, important question, and here's the scoop. So the science tells us vaccinated people can be without masks. You are always going to get the science from me. You can take your mask off. But what we're confused and concerned about is the school guidance has decided to stay put until the end of school year. We have a very complicated mixed delivery space for the 3- and 4-year-olds with pre-K. And if school guidance is saying all the adults are masked, and we shift and say, but childcare providers can take their mask off, that we feel there's going to be a lot of confusion. But of course, there's been tons of confusion in COVID. So maybe that will be where the policy people land. But I do want to have a really open dialogue with you all about child development. And we're getting a lot of different opinions on this, and there's no answer. But many people believe that adults who work with children should mask as a model, especially the littlest, where you can't say to a 2-and-a-half-year-old, 3-year-old, I'm sorry, I'm not wearing a mask because I'm vaccinated, but you can't be vaccinated because we haven't approved it yet. Therefore, you keep yours on, right? That's a logic system that isn't easy for child development for certain age groups. But the other argument is there are tons of child safety and other rules that we impose on our children that are not true for adults. Car seats is a great example. You have to be rear facing for a while. A lot of kids have a sibling who gets to turn and face forward and is still facing back saying, Mama, why do I have to be backwards? And we say, because you're not 4 or 6 or 8. So I think some of you will tell me that you think kids can handle the complexity that you're unmasked as a vaccinated childcare provider and the children you serve are still masking. And others may weigh in pretty strong that you think everyone in a program should have a mask on as a sort of solidarity exercise. I have no answer for you, which is so unlike me. Ben Lee, our pediatric infectious disease leader, who's been a great resource to all of us for the whole year, he wants everyone to keep the mask on to support our youngest while we're, getting more people vaccinated and getting the case counts even lower. But other pediatric leaders will tell you it's completely silly to have to mask when the clear CDC guidance and the rest of Vermont's policy is that you can go unmasked. So we hoped that today by Thursday at 1 o'clock, we would be able to tell you definitively where Vermont landed, but unfortunately there were multiple meetings this week and they ultimately are meeting again this afternoon. And when I say it's this restart committee, which has epidemiologists, governor's staff, people from the Agency of Commerce, Community Development, and Education, childcare, your colleagues at AHS. So I'm really open to questions, but what I really want to hear is your opinion, because there's nothing about the science that's debated. I stand with the CDC. Vaccinated people don't need masks. So the question really is what to do with this really important space of people that don't have masks on. I mean, the people that aren't vaccinated, and that's your lane with all of those beautiful children. So we'll keep moving, but hopefully double back to that and see. It's a small enough group that we should be able to have a lot of dialogue on that.
Thanks, Breena. Yeah, I'm sure we'll be chatting more about masks. I know there's some questions in the slides as well about them. So just really quick, two other pieces with the guidance. One subject matter being distancing. So, it's clear in the guidance that, we really want children and youth to keep 3 feet apart as much as possible. And that's what we've been trying to do. And we're just doing our best at, and it's hard with these little ones and you're, hugging them and all the rest. So it's do the best with the children and the gold standard being 3 feet. And as far as distancing, the guidance is that staff and adult visitors or volunteers would be 6 feet from other adults. Where it gets complicated is that with last Friday's step 3 and the changes with Vermont Forward, distancing for vaccinated folks is currently not applicable. So really the best practice guidance be outside, try to continue to promote distancing as much as possible. One of the other best things that we can do to prevent COVID is to keep your distance. So I'll just say that. Next slide.
Yeah, I can chime in a little bit too.
Go for it.
Oh my gosh, Zoom does not like when I start talking, all that feedback. We got ourselves in a complicated communications loop when, prior to the CDC's announcement last week about vaccinated people being able to go maskless, a week prior to that, there was Vermont's decision that if you were outside and distance, you could be maskless, which was regardless of your vaccine status, which led to, so we tried to message to the childcare field that because you guys can't do distance, because why could you? I mean, you have little kids and you need to be with them close. We're not going to do anything about that take your mask off outside general guidance. But some of you misinterpreted it to mean that we were going backwards on something. We were just trying to acknowledge that there is no distancing in childcare. So that's always been a really awkward part of the guidance. And we've done a lot of like, do the best you can, as Margaret said. So I also wanted to note from Sally's early slide, July 4th is a goal post based on how many people we can get vaccinated, but we have exceeded all of the step anticipated dates by 2 weeks. So if you're asking me as a scientist, we're going to be mid-June. At the rate we're going with how well we're getting people vaccinated, by mid-June, there's going to be no sector-specific rules. There's going to be general guidance to just encourage masking and try to distance, but it's going to all fall into the personal responsibility. And that's going to be a really important space for all of us to talk together, because I have no answers for you about how that's going to look. I think some families are going to feel better with masking. I think some of you are going to say we're going to skip the masking, and you're not going to get guidance from the state about it anymore, because we're going to be very dutiful with our governor that it's a personal choice decision or a business specific decision. So you're really only looking at 4 weeks of this muddy pond of who's masking and who's not based on some state policy. And then you're going to have to head into a more of a personal conversation about your home center experience. I just really need you to know that. And we're right here with you, and we're having trouble with it. And I'm sure you are as well, but it's going to be different than the CDC. So the CDC is saying, keep childcare kids wearing masks, but that's not where Vermont's headed. Vermont's heading toward make your decision at the personal level, not at the policy level. So when I talked to you at the end of April, we talked about this, that we're experiencing a lot of psychology here of how to march across this divide between what we've been doing and what we're going to be doing. And I just want to acknowledge that it's lost. It's like, punched up, very simple. Here's a question, here's an answer. And now we're just living in this super vaccinated state with very few cases and learning how to be together with distancing and masking. Okay, I'll stop there, Margaret, and let you keep going.
Thanks for expanding on that.
I can chime in on the travel. Here's the overall travel slide, but I'm looking at the question in the box about travel. As of the phased reopening, there's no travel requirements. If you travel within the United States and come back to Vermont, you don't have to get tested. And that's very recent, and it's updated on our website. If you're going to travel out of the country, to look on our website, and there's links there to the CDC website about travel warnings for the other countries in the world. And when you look in the map, it's pretty red. And so it says here, so this would be, I'm thinking who would be traveling a lot. There might be cruise ships or Bahamas or that sort of thing, those kind of vacation spots, in addition to many other reasons for travel. And those at the moment, people need to be checking the CDC site because those areas are red. Then it's the question, I don't know, Breena, if you have any other thoughts about if someone's unvaccinated traveling out of state and coming back, there's no requirement for them to be tested.
Yeah, I can answer that.
Yeah.
I think I know what happens with Zoom. I think Zoom wants one person to mute before the other unmutes. I think it's having a sensitive day. So there's Q&A, but I did want to note in the chat, which I'm more familiar with following my Zoom experience, that Lindsay's got a good question here. I just want to really air this out. Lindsay wants to know about unvaccinated people traveling out of state and returning into a facility where 90% of you aren't vaccinated because it's all children. There is no testing of those people. And we've been very clear that if you have any state funding, you can't make your own rules about testing or quarantining. Everyone is supposed to get tested when they travel, but there's no enforcement or accountability for on you or us as a state to collect those test results. So the messaging for you as the childcare person is, if you've traveled out of state, you must be tested within 72 hours of return, and just leave it there. And that if they choose not to, that's a low risk activity. It still puts, it's a slight risk, and I can feel from the question that you're concerned, but we have to see it as a low risk activity, because that's the guidance. We've stopped thinking about travel the way we did early on. And then you're going on to note that it's a second home, and how can I make people that fly to Nashville get tested? You really can't. And COVID is so intense. So it's always been true, but it's even more true now. This is all relational, where you've got to sit, as you do beautifully, and talk with your families about, get that test. Not so much vilify, putting forth that travel is the risk, but that is just state it, that when you leave this state, you must return with a test, and just try to get out of the emotion of who's collecting that result and is a person really complying with that requirement. It's truly a requirement. It's just that there's no.
So, Breena,
and then Grace is noting, sorry.
Yeah, I'm getting confused. Oh, go ahead.
I need to make one comment. So folks are starting to use the chat box, and the chat box doesn't get saved in the same way that the Q&A does. So please, everyone, if you have a question for Sally or Margaret or Breena, please put it in the Q&A. That way we capture it, we save it, and we can actually post the answers on our website so that all of the information is recorded. Please use the Q&A. Thank you so much.
Yeah, that's a good reminder.
Sally,
Brett.
I know what's happening. Yeah, everything I just said is a misspeak.
Okay.
Because on Friday the governor changed that. I'm so sorry.
Yeah.
I mean, who said COVID is intense?
Yeah, this is what happens.
You can't ask for a test. There's no testing. You're right. That went away Friday afternoon. And it's my fault too, Brenda, that we're using the chat, so I'm not going to look at the chat anymore. I'm going back to the slides, and we'll do Q&A at the end. I'm so sorry. Back to the slides, Sally,
Right. So as Breena and I are figuring out, as of just the end of last week, there's no requirement to be tested when you return to Vermont from traveling within the United States. And Breena, I had to fess up, one of the reasons why I know that is because I heard a chat from the people who work on the website, and they were saying they were quickly wanting to update the website on that because it's something that's confusing to people. So that helped me remember that. And I'm trying to remember, there's still the restrictions to travel to Canada. I know that's a huge, for those of us who have families in Canada, and also for the business community. I know that's a huge problem for them. So I don't think of Canada as international travel, though. Technically it is, but not like India. So, okay, I'm finished wandering around. Next slide.
Okay, so really just wanted to spend a few minutes chatting about how Vermont is doing spectacular in our vaccination rates. We are leading the nation. We are so proud. And just wanted to put this slide up and just give you a window into kind of where we're at. And the left part of the slide really breaks down the overall progress per county of vaccination rates. If you go on the website, you can break it down into ethnicity and do all sorts of things. But really kind of our rates, as we've said before, and how well we're doing with vaccinating our population is the driver of where we are with moving forward with Vermont Forward. And that's why Breena was talking about how we're really kind of ahead of the game here with what we thought. And it's possible, it sounds like, that by mid-June, we might have reached that goalpost with universal guidance associated with COVID. So, so this is really encouraging. Next slide. Just really wanted to spend a minute longer talking about vaccines, as far as just noting that they are safe and effective. These vaccines have gone through all 3 phases of normal vaccine trials, and they are protective against the variants. Vaccinated people are unlikely to spread the virus. And if they do happen to get it, they are less likely to be severely ill. Just wanted to talk a little bit about how, just generally speaking, you know, vaccines are not, no vaccine is 100% effective. And that means that, you know, if you get your flu vaccine, you might end up getting the flu. So there's no 100% vaccine. And these vaccines are some of the most effective vaccines we have ever made. They're 95% effective. And in Vermont, so maybe like 5%, right? At the time, it might not be effective. And in Vermont, our data point is that less than 1% of cases since January of 2021 have been among vaccinated Vermonters. So just so thankful that we have this amazing opportunity to protect our population. And, you know, I'm not sure if you all follow kind of the rates of COVID cases on a daily basis, but sort of once we hit that 50% of our population being vaccinated with 2 doses, our numbers have dropped substantially. So we're rolling in like 30 a day versus 100. So it's super encouraging, and I think it'll drop even more as we go along. Next slide. So the next slide, just we have your questions, and we're going to kind of have Breena tackle them and the incoming Q&As.
Oh, next slide is, so the questions that came in ahead of time, we're going to answer verbally, and then a little bit in writing here as well, and then we'll get to the Q&A. And just really apologize about that travel glitch, but Lindsay has a question follow-up, so I'm going to answer that. Can preschoolers students be fully immunized before the school year? What's the progress? So we were actually feeling pretty hopeful. There's tons of trials for 6 months and up right now, both Pfizer and Moderna. And we were hoping for early fall. The health commissioner said today on a different call that he was hearing in the last few days that it's actually going to take toward the end of the fall. And he was predicting early 2022, which is disappointing. I don't know what his source of information is, but we will update you as soon as we know. I did want to really offer to you all, as Sally said, we've had 9 town halls with pediatricians talking with families or all around the state. We have 2 more tonight, 1 on Sunday, and then we're done. It has been so heartening to be reminded that pediatricians really know how to talk with families about vaccines. There's no harm in talking through questions and concerns about our children. This is not a space where we feel that people should be pushed along in their decision-making about their beloved children. So I know this does not relate to your professional lives based on the age, but if you have personal questions about your own families and your own children, or just want to talk about vaccines for children, our team and me in particular, I would love to talk to you if you can't get to these town halls. But they also are taped if you're bored. You know, if you want to sit through a whole hour of other people's questions, there's a lot of shared learning to be done. And I have benefited greatly from just bringing the community of our incredible Vermont pediatricians into this conversation. So I'll just speak as a person who's been in the field 25 years. There's never been a safer vaccine for children. It's a messenger RNA technology in Pfizer that's actually been around for at least 10 years. And it's a very pure way to tell your immune system to get going to build protection against a virus without any actual virus. And it's also one of the most effective, if not the most effective vaccines we've ever had. 100% of children in the trial 12 to 15 developed antibody, which there's no vaccine that ever got that level of response. So it's very exciting to me, and I would love for you to feel comfortable in this space. Next slide. It's frustrating there is often inconsistencies with the information provided by the Department of Health, depending on who you speak with after hours. Parent phone calls through contact tracing are the most inconsistent. How can we get consistent and accurate information? Is there something that we can do on our end to facilitate this process? So this is really important feedback for us, and it's really important that we all pull together. So I would say that our team, as a school and child care team, needs to hear from you the specifics when you have a messy, inconsistent set of communications. We are transitioning big time in the public health system into our, it's called, now that we're endemic. So we are heading out of this pandemic, and I know you can feel it, but that doesn't mean there aren't still cases. And the cases are now slowly going to be managed by a specific team that are not, we pulled everybody out of regular jobs to be on the contact tracing team, and they're slowly returning to their regular public health jobs, and we're leaving this separate unit. So in that transition, I wonder if there's some growing pains. But this might have actually preceded that transition, and I'm sorry to hear it, but I'm not surprised, because you can see even from this webinar, like I knew the travel testing had been dropped Friday, and then it left my brain because it's so much change. So this idea that your parents are getting different guidance is super concerning to me. So please let us know if there are specifics. And I do agree that if you get a different person, somebody interprets things sometimes differently, like I just did. It wasn't me interpreting, it was just that it changed, and you can't keep up with everything that changes. Next slide. What's the transmissibility of new variants? And the answer is, and thanks for becoming citizen scientists, because this is, boy, do we know a lot more about immunology and virology than we did a year ago. The variants are definitely more transmissible, but luckily people aren't getting sicker. So in the fall, if a person had COVID, it would be like 1.7 or 2 people in their close contacts that tested positive. And then in the spring it became, or in the winter, it became more than 2, 3 people would contract COVID if a person had COVID. And that's reflective in your experience, I imagine. And it was definitely visible on college campuses. So you may have tracked UVM, and other schools were very transparent about their cases, and someone with COVID definitely had more close contacts who tested positive. We're very lucky. These variants are all protected. The vaccines are all protective against the variants to date. Beautifully protected, like the same as the original virus version. So that part of the reason I feel an urgency to get 12 and up, children 12 and up vaccinated, is because when people ask me, should we just wait this out a little longer for my 12-year-old, maybe see what the summer and fall bring, it makes me very anxious and nervous, because the virus is going to change, and right now I want us to get everybody protected, and then if a new variant comes in, that level of protection will sustain, as opposed to the risk of getting a new variant, actual COVID. Next slide, please. What will guidance look like for childcare providers that aren't vaccinated? So Vermont's very clear on this. We're not heading toward a state where there's a passport or any kind of proof of immunity. Now, private businesses have their own autonomy in that space, but from state policy perspective, this is not we're not entering into the bifurcation of who's vaccinated and who isn't. I am super curious about this question because and I've heard from many of you that your colleagues are less vaccinated than I expected. And I guess that's not super surprising. If you look at other sectors, you know, there's some studies out of Massachusetts that the state police, 30 or 40% are vaccinated, which is pretty low for a public service field. So I'd like to spend some time in this space together because I like talking to people about vaccines, and I don't like to say people are hesitant or even against vaccine. I think people are curious. And I also wonder, where are people getting their information? Because the internet, you know, the American Academy of Pediatrics was able to show that the fake news about vaccine safety is coming out of maybe just 5 or 6 national entities that are directing it to the internet intentionally. So I know I don't have to tell you that we're all in information overload with where we get information. So I would hope there would be trusted medical providers in these folks' lives that could talk them through the importance of vaccination especially if you're caring for children. So no guidance difference. We're heading toward honor system. We're actually already in honor system. If you think about the new Vermont policy that you can be without a mask if you're vaccinated. So who's asking? There's no asking, right? Except in private business. Next slide, please. When do we anticipate masks to not be required for vaccinated teachers and parents? So I think we've grappled with that a little bit already today, that we are heading there in mid-June, late June, July, that it'll be a personal decision. There will be no requirements. Your guidance will remove everything about masks. It won't even be in there. However, the next few days, the next few weeks, until you hear differently from the field, from us and Let's Grow Kids and your colleagues at Child Development Division, we're still requiring masking for adults, even if you're vaccinated. Next slide. What is the plan should be for programs that house Act 166 programming on site, as the regulations through Act 66 are different? We are planning on keeping masks on until we are out for summer, and then once the school year ends, moving into Vermont Forward. That's correct. That is a great plan. The schools are, I really think we're going to get lucky here, that the vast majority of Vermont schools are officially over like the 3rd week of June. And I think, me personally, prognosticating with the vaccine rates, that's exactly when we're going to be in the final phase of Vermont Forward. So we'll have a week, the schools wrap up, the pre-K programs, the 166 like you're describing, have been following the school guidance. School guidance will be gone, tabled, no more school guidance. And then you will move into the universal guidance of a mask encouraged personal choice space. And again, I am not predicting this is easy. I just want to be right with you on how this looks and how people want to roll, because we're stepping out of the regulatory executive order government guidance, and we're stepping into sort of a, how do you and your families want to work together this summer? Next slide. If we plan to have children and families continue to wear masks until Vermont Forward stops the mask mandate, would we need to get approval? Stay tuned. I know what you're asking here, because we've been very clear, when the state declares something as policy, you can't go over it. Travel being a great example. You are not in a position to quarantine or require quarantine of your families after travel. When April 9th, the state said stop doing that. So if it comes to be that masks are no longer required for adults that work with children in your space, we will have to have a conversation about this, because you can put in your own mask requirement in certain circumstances, like if you're a private provider. But we're going to be in that same space about if you have public pre-K dollars or other state funding, you can't be more restrictive. So that one I can't fully answer, but I'm pretty sure, I mean, I shouldn't say this, but I think we're going to just keep it that we're masking adults for a few more weeks who work in childcare spaces. And I will let you know as soon as I know. Next slide. Okay, on to the Q&A, Brenda, my favorite part.
Yeah,
I'm
and
going to go right to the top.
Thank you so much to all three of you. And I also just wanted to remind folks that I heard Breena at least say she'd really like to engage with you. So it could be that you want to respond to one of the points that she made. She asked a couple of times, what do you think? How do you feel? So that's also a good thing to put in the Q&A. And I just want to note that a number of the questions are related to points each of you have already touched on, but that are looking for a little more detail, or sometimes a little more nuanced situation. And so we'll begin with, do unmasked adults put children at risk for contracting COVID?
Yeah, if they're not vaccinated. So, I mean, I was really glad that Margaret and Sally wanted to talk about breakthrough cases, because I have a lot of need to remind everyone these are the best vaccines we've seen in my whole career in terms of their effectiveness. And if a few people get COVID after the vaccine, that's entirely expected. But it gets in the news, and I think people are like, some people use it as evidence that the vaccines don't work, and that's really not the message. So I just want to say that vaccinated people can get the virus, but they sure don't transmit it. And that's another great thing. So even if you get COVID after a vaccine, you don't get very sick. It's really rare to get sick, and you don't transmit with any efficiency. So vaccine, vaccine, vaccine. If you have unvaccinated people around children, yes, the virus is going to stay in our communities. We're going to be at some nice baseline level. I can't really predict exactly, but there'll be a few cases in every community all through the summer, and they are likely to come from adults to children if the adults are unvaccinated. So I know I sound like the governor here, but like, all hands on deck to get vaccination as our top priority. And as Margaret said, we are so lucky. Vermont's rates are extraordinary, but we have an interesting demographic of our 18 to 29-year-olds that are actually coming in lower than other states, and definitely lower than the kids, which I'm curious about. So definitely lower than 16 and 17-year-olds. Don't really track the 12 to 15-year-old data yet, because that's going to lag a bit. So the data on the dashboard is excellent, but it's sometimes a few days behind some of the pharmacy vaccines, because we have to get all that organized. So, okay, I'll keep going, Brenda.
Sorry.
Go ahead.
Someone noted that they had experienced in their program a breakthrough case. And I know we are really trying to keep it focused here on the early ed experience, lived experience. So there was the question related to that was around, is there data around which vaccine has the most breakthrough cases? And I'm not sure that, that.
I have not seen that data, Kelly, so I will put that on my list. I would imagine if there was one that was more likely to do that than another, we would have heard, even in the news, but I'll make myself a note. They are all similar efficacy, as you know, especially for preventing serious disease and death. So I imagine the breakthrough rates are similar. But so Ruth wants to know, would a best practice for childcare be to take temps of children, not record them, ask about illness, note injury, and do visual assessment? I would say sort of. I like what you're noting here. It's definitely best practice for a childcare provider to check in with each student or each child each day with a sort of visual inspection and a check-in. Adding the temp check to me seems a little bit out of that's a little extra in our wanting to keep this simple and not do temp checks at childcare unless you have a reason. So the universal temp taking has come off our guidance, but you are welcome to take a temp in the context of a child that doesn't look well. And then Grace is weighing in. Several of you have weighed in. This is exactly what we need. about the message to send to parents about they see schools masking, they should see us doing the same. So that's Grace's wonderful opinion. I happen to support that. I think we just, the next few weeks, everybody stays the course. But again, let's see what the policy folks say. And then Ruth also agrees modeling is a principle. Wouldn't it be best to remain masked if staff are a mix between vaccinated and unvaccinated adults? I sure do support that, Ruth, but that's complicated with where we're heading because the state really wants to drop that type of recommendation. The state's heading toward this personal choice, which I'm not sure what if your program's private, you could have that autonomy. That would seem more consistent with saying volunteers are only allowed if vaccinated. We are not allowed to require staff to be vaccinated, so differentiating based on, I completely agree. And other directors really should weigh in with Ruth. This one's hard for me. As you know, I'm a very strength-based person. I just want everyone vaccinated. So if there's a subset of us not vaccinated, I think I don't want to know that and create some sort of us and them piece of that. I just want the society to be protected by most of us doing the right thing to protect children and leave it there. Complicated for sure. I really can't think of another example in our lives where we've had to be so interested in other people's health decisions, right? I mean, it's true in flu. We've always bumped along wishing more people are vaccinated for flu, but there's something about that that still feels like someone getting flu is their own. I mean, they do transmit it to others, but not like COVID. So people get sick with flu, it's on them and their decision not to be vaccinated. It's different. So Becca moved her question over. I think, doesn't the CDC recommend in childcare for the masses that their statement on ed masking, even this AM, the main CDC website still lists required for childcare in schools? That is correct. So what I put in the chat when I was disrupting the process, we've never been 100% aligned with the CDC in Vermont. And a lot of that is because we've done so much better than the rest of the country in both vaccination and case counts. Now, not always, but if you look at the 14-month experience, we can't just follow CDC in every way because they had more prescriptive guidance early on that led to, we were able to open childcares in schools in a way that kept us safe, that was different than CDC guidance. And now they're saying schools and childcare should have their own lane on this mask requirement, but we're heading toward different than the CDC, with Vermont saying that's just a personal choice. So stay tuned. I'm curious about how we use CDC in Vermont. It's been important because we do have our own epidemiologists and our own experience. So Ruth also wants to know whether there'll be a definition for encouraging for masking. Boy, we sure haven't gone there. What I'm curious about is this word childcare guidance, you guys. I feel like the guidance after this final step for Vermont Forward is you're going to go back to basic childcare guidance about caring for our children, infectious disease principles, and all of your regular best practice. So we're not going to mention masks or distancing in the guidance. In fact, the guidance is probably going to go away. I know that's really jarring, but it is. And we may keep parts of it for the summer just to help transition with cleaning and when people have questions about food service and stuff. But in terms of masks and distancing, you're going to just be in the universal guidance. So that word encouraged isn't going to be part of our vernacular in guidance. It's just going to be the state's approach. Lindsay's saying I do not have to have, oh, this is back to the travel. So I don't have to have unvaxxed kids get tested at all. Is it smart to wait 2 weeks and see how this is panning out before I change my policy? So Lindsay, no, I mean the travel, Sally helped me see, like travel is has no restrictions at all. So those children are welcome in your program. I still really want everyone tested who has symptoms, because that's how we're going to continue to know what our baseline rates are in our communities. I don't know if you guys follow the denominator of how many people are tested every day. You know, we have that % positivity rate, which is super low. We have minimal cases, but keep track of how many people get a test, because the number of cases reflects how many people are tested, right? That's on the website. Do you think unvaccinated volunteers will be able to come in after June? Yeah. I mean, again, the guidance is going away eventually, so you're going to go back to your regular policies about visitors and volunteers. But I'm conscious as I'm speaking that some of you have more autonomy than this as a private provider or a family child care home. So don't take any of this as absolute in that space, but from a state government guidance perspective, there won't be vaccinated or unvaccinated restrictions. Kelly wants to know, or we have allowed vaccinated staff to jump around to each classroom for coverage. Do you think we can have unvaccinated bounce around, or should we keep what we are doing until all the rules are lifted? Yeah, I would stick with what you're doing. I don't have tons of authority to say that, though. I just think it's a good common sense best practice. In the guidance, we're clear that you can have staff cover different classrooms, and we do not differentiate vaccination status, as you know. So that seems like something you've worked out personally, and also asking, can vaccinated staff be unmasked now if they're not around children? So I think we've addressed that a few times, Kelly, but just to state it again, we're asking at 1:57 on Thursday that everyone stay masked in the care of children, vaccinated or otherwise, for now until we hear differently. If we know we have some families who are not planning to get vaccinated for COVID, how should we handle returning to have those adults come into our center, especially when some staff are not comfortable and not vaccinated? Yeah, so these questions are awesome and important, but so we have to keep saying to each other that after this magic date, when we have, 75% of eligible people vaccinated, all of these questions are going to fade away, because we're not going to ask people if they're vaccinated or not. We're going to know that we're as protected as we feel safe. We've reached a scientific threshold of safety, and we're going to be moving about without the same fears we had for the last 14 months. So families that aren't vaccinated, staff who aren't vaccinated, that's just people. They don't move about differently in the post, the late June or July Vermont Forward. I will say every time I hear these questions, I have the same reaction, which is, could I please talk to these folks to see why they're not getting vaccinated? And I'm not saying me like I'm some center of the world. I just think trusted medical professionals just to work through people's fears and figure out what's going on here, because we have suffered so as a society, and our children and families have suffered. And the path out of the suffering is more people vaccinated. So I'll do one or two more. I'm not going to end on the attorney question, Ariel. I worry how to manage masking, since our HR attorney told us that we couldn't ask staff's vaccine status. Exactly. So we're not asking you to. This is an honor system space that the governor is very comfortable with, not in childcare, just in general. From last Friday, hey, Vermonters, if you're vaccinated, take your mask off. And we're just leaving it there. But I'm fascinated by this, because we have to stay in a space that people are going to tell the truth. And I acknowledge that our worlds, there are fibbers. We've had a lot of fibbing through the whole pandemic. Remember, we had a lot of people travel that weren't sort of supposed to. We had a lot of people come back and not quarantine. We had a lot of people that didn't quarantine when they were a close contact. So, but we've done beautifully. So I'm super hopeful that all of that space of who's vaccinated, who is not, we just continue to put the energy toward more people getting vaccinated. Brenda, I'm sensitive about time. There's 3 more questions. I can go really fast to say that Lindsay was thinking that ensure new hires be vaccinated. If you're a private business and you have attorneys helping you, vaccine requirements are a cool topic. And watch the state grapple with a few things, you guys. Like, what about school mandate? We do require childhood vaccinations to be in our public school system. So are we adding COVID? That's a big one. Colleges are all the private colleges are coming in with vaccine requirements for staffs and teachers and students, but it's going to be harder for public schools, like University of Vermont has not decided. And Kelly's saying, so you're saying all the guidance will be gone after middle of June. We'll still follow guidance around symptoms and exclusion. Yeah, so again, Kelly, like, first of all, don't quote me on the middle of June. That's a Breena prognostication. July 4th is still the date stated by many, and they have the beautiful fireworks. But I will say, in the context of guidance, yes, this is where Margaret and Sally are really going to help. We want you to go back to the world where sick people aren't in your program. And of course, you check in on symptoms, and we get the right social policy so that children, we don't have everybody wandering and getting sick. So many families have pointed out to us, this is the healthiest year their children have had, because we were masked and we were really careful about our symptoms and spreading. And so, yes, you're still going to live in a world of symptom check, but not in this official screening. But I hate the word exclusion, but you still need to have sick people at home, including your staff. So let's spend more time on that together this summer, of how on earth we're going to live in a world where people who are not well are absent, at the same time acknowledging it's a big stress on families. And we'll end with Ruth, that some people don't trust the vaccines. I completely know this. And I'm sure you know that pediatricians are experts in talking about vaccines. It used to be, 15 minutes out of a 20-minute visit in my pediatric practice was talking to families about vaccine safety. So it's an important space. We're never going to get everyone there, but we have way more people there than all states. And we also know we can even do better, because Vermont likes to pull together. Yeah. I'll stop.
So this is great. Thank
Q&A.
you. Well, yeah, so yeah, check. Thanks everyone for coming out for this hour and 3 minutes with Vermont Department of Health, Dr. Breena Holmes and Sally Kerschner and Margaret Tarmys. As Breena said, stay tuned, and hopefully you can all get outside and enjoy some of this gorgeous May Vermont weather this afternoon. And we'll see you again next month. Thanks again, Margaret, Sally, and Breena, for being with us. We'll post all of this on the letsgokids.org website tomorrow or the next. Have a great afternoon.
Thank you.